Hi, everybody. I think everybody knows me. My name is Rachel. I'm part of the care team at PPMD, and I'm really happy that you're here today. I think this is going to be a really great conversation. So, as a reminder to all, this is a closed webinar that was extended to all of our industry partners in this space that have approved therapies or will be coming online with approved therapies in the near term to kind of frame some experiences that we've been hearing from our clinics and talk about ways by which we can work together. Let me see if I can advance my slide. Okay. So as a reminder, today is going to be recorded and you are not able to see who is also in attendance. And this is both for confidentiality purposes as well as compliance. Throughout our presentation, we welcome any feedback, any questions, any experiences that you would like to share. Please feel free to drop those in the chat. And rest assured that only the PPMD team will be able to see what you have placed into the chat. At the conclusion of the webinar today, we will share with you a recording of the webinar itself, not the chat transcript, so that you can share it internally with your team. And we also welcome, any follow-up questions or conversations after the fact as well. All right, so to map out our conversation today and why we have brought you all here and are so happy to have you here with us, we're going to talk about a timeline of currently approved therapies, as well as how that has led to a real inflection point in 2024. We are facing a whole new landscape of current issues, and we've identified a lot of needs at the clinic level so that we can work through some of these issues as they have come up. From there, we're going to open it up to some discussion. We recognize that it's a little bit difficult to have an interactive and engaging discussion when you all are on chat, and Kaylin and I will be on video. But leave it to say, we would love to get your feedback during that period of time, even if it's for later follow-up. And then we'll talk a little bit about opportunities for collaboration with the PPMD team and next steps. Okay, so a timeline of approvals. These drugs should look really familiar to everyone on the line for obvious reasons. This is the timeline from 2016 through the end of 2023. So not 2024, just 2016 through 23. And I think that this is both amazing and terrifying. We've been really busy the last 8 years. We have seen a massive shift in the landscape for access to approved therapies in the neuromuscular space and specifically in the world of Duchenne. So you see on that far left-hand side, September of 2016, when Exondys 51 was first approved, we have been very busy. I've also added a few SMA drugs here. And the reason behind that is that we recognize that the landscape is shifting significantly and the impact on our clinical teams has been great. And the reason behind that is not only all of these Duchenne approved therapies, but these are the same teams who are also working on SMA drug approvals and working with that overall neuromuscular population at large. So from 2016 to 2013, we've been doing really well. We've had all of these drugs come online. We've worked through payer policies. We've worked through, inclusion in state-based Medicaid programs. And we've worked really hard to ensure access to anybody who is eligible, whether it's working through prior authorizations, repeated evaluations in the clinic whenever that prior authorization is up and needs to be recompleted. But we've kind of hit this sort of cadence where, it's a lot, but it's working. And the majority of these drugs have not been broadly applicable. So it's, lots of patients on Emflaza, for example, but not everybody is on a PMO or another approved therapy. And so it's been more or less manageable. However, that brings us to 2024. And I don't know how many times I have had the conversation with parents, with clinicians, with my team, with industry partners about how 2024 has just been wild. And it really has brought us to this inflection point where we're seeing this huge influx of approvals and commercializations and broadened labels, hopefully, kind of all at the same time. So that last slide, I think, was helpful in illustrating, how far we have come. But when we think about 2024 sort of in a vacuum, we have a lot of different moving parts and pieces. So in February, we saw Emflaza's loss of exclusivity, which has led to a really unique conversation in the community about brand drug versus generic and what transitioning looks like, what staying on brand looks like, what are those different pieces of authorization, conversations with insurance companies, with your clinical team, all of those different pieces, right? And then just a couple of weeks ago, we saw the commercial launch of Agamree, which is amazing. This is fantastic that we have another opportunity for our individuals living with Duchenne to access an approved therapy, but it's broadly applicable. And so there's a lot that comes with this therapy that is available to individuals that is of a significant appetite and is not mutation specific. And so I think that we're going to see a lot of feedback from the community as this Agamree commercial launch sort of continues forward. And then just last week, we got the approval of Duvizat, which again, broadly applicable. Like, this is huge. This is so exciting. And I think that, the community recognizes the importance of this approval. I mean, we have a concurrent webinar running right now with the community that has, I think, one of the largest showings we've ever seen. So the appetite is there. And we recognize that because of that broadly applicable appetite for this new therapy, there's going to be a lot of downstream implications as we look to that commercial launch in Q3. We're also, 3-ish months out from the PDUFA date for Elevidys and a potential expanded label, which again, we're talking about additional access to therapies for additional patients who haven't had options available to them. And this is life-changing for these families. But it's difficult to manage all of these moving pieces and parts together as we think about a potential influx of patients to a therapy and everything that comes with it. So if we think about 2024 in a vacuum, this is a lot, but it's even more when we think about all of these activities taking place while clinic teams are maintaining authorizations, obtaining new authorizations for previously approved drugs, and handling everybody that's already on approved therapies. And so that has led to a whole lot of chaos. Let's just call a spade a spade. So what do we make of all of this? We've been having conversations with our clinics to understand what this experience has been like for them so far and what they expect moving forward. And truth be told, simply put, they're overwhelmed. Teams have gone from managing, they've gone from, this sort of maintenance type of phase to maintaining while managing this massive influx of new authorizations for therapies that are both broadly applicable and or high cost and high intensity in terms of the onboarding, the screening, and then the maintenance and monitoring thereafter. And so what does this mean? This means that we're coming to this massive groundswell of workload for our clinics that, in a sense, is almost temporary. We can see that they're going to have to accommodate this influx and find their new normal. But truth be told, finding this new normal is going to be challenging, and it's going to have broader implications. So what are some of those broad implications? It's really a trickle-down effect, and it really impacts each and every sort of spoke of that wagon wheel, if you will. So the neuromuscular specialist is really providing a lot of support for that PA, whether it's, signing off on letters of medical necessity, doing peer-to-peers, all of those different activities. Obviously, one of the biggest impacts is on nursing and admin support. They're the ones on the ground in the trenches doing PA completion. They're coordinating with specialty pharmacies. They're liaising with patient support programs. They're working through all of these pieces, meanwhile communicating back to the family their role in this process. So this is incredibly time intensive. We've also heard that the physical therapists are inundated because they're doing perhaps either additional or extra outcome measures. They're having to schedule one-off appointments for patients, bringing them in because the payer policy requires a certain assessment and a certain time point as it relates to the prior authorization window. And that can be really difficult to add that additional sort of set of appointments on top of regular clinical duties and perhaps research duties. then it impacts the patients ultimately, right? So this is potentially leading to delayed access to drugs, causing stress to the family. They're having to navigate enrolling in bridge programs, and they're not sure if they're going to receive drug on time. And this is something that we have seen kind of play out in the social media landscape, where patients are frustrated, caregivers are anxious about all of these pieces coming together and potentially leading to delays in accessing their therapy, which is terrifying. We also are appreciative of the implications on specialty pharmacies. They've got an increased workload navigating delayed authorizations. I think one piece of feedback that I heard that was really impactful was, we're starting the prior authorization process early because we know it's going to take so long because of all of these delays, because of the overburdened teams. But even when we start it early, it still doesn't happen in time. And so that has an impact on, those brick and mortar specialty pharmacies. And then also on our pharma partners here with us today. This can ultimately lead to a really high utilization of free drug programs, which is fine as long as the patient gets their drug, but it's not ideal. We recognize that there is, a business aspect to all of this. So no matter where you're coming at the situation from, it affects you. So what are our needs? We have been really privileged to lean heavily on our certified Duchenne Care Center network, as well as several other clinics around the country with whom we have longstanding relationships, to just understand what their experience has been, to really dig into, where are the needs? How can we be supportive? Where can we help you? And what might that help look like? And the same themes came up time and time and time again. One being time. There are not enough hours in the day to get all of the things done. And it leads to backlogs, and that can ultimately lead to delayed access to treatment. We also recognize that they are in a period where they need to upregulate their staff. So what does their FTE look like? How many people do they have on their team who are educated and able to engage in these different activities associated with access to therapies? Because they might not know until they get a label how many of their patients are going to be eligible for a certain treatment. And so it makes it really difficult to advocate to hospital administration and have that admin team really recognize the intensity of the efforts that go into these different approvals across the team, from the physician to the nurses to the therapists to the admin staff to the pharmacy staff and more. So we want to be able to help them. Ultimately, I think part of this too is that our pharma partners have been sharing some of these sort of experiences with us. And so I think I would just really like to pause for a moment and invite you to share what you're hearing from the community back to us. We recognize that we as PPMD know what we know, but you might be having different experiences, different conversations, and hearing different things. And so please feel free to take a moment and drop any feedback into the chat. Again, recognizing that only the PPMD staff will be able to view what you plug into the chat, and help us understand, your perspectives and your experiences. I think that this really helps us as we sort of formulate and guide what a plan forward might look like and how we can be most supportive to our clinic teams. Okay. At this point, I am going to go ahead and hand things over to my teammate, Kaylin Moitoso, whom you all know very well. So Kaylin, I will let you go ahead and dig in.
Awesome. Thanks so much, Rachel, and thank you all for being here today. I know that we've had the opportunity to have several one-off conversations sort of about this landslide, right, that we're experiencing. I do think that we had anticipated more issues probably last year, right, with the launch of Elevidys. And I think what we're seeing now is, as Rachel explained, with the boom that happened, it's happening right now in 2024. What we had predicted happening a little bit earlier is reality. So what are we going to do about it, right? So I think we're going to do what PPMD always does, right? We're going to try to convene everybody in a pre-competitive or anti-competitive manner so that we can figure out how to address issues together with our clinicians, with our industry partners, with our families. So again, I know that we've had the opportunity to speak to many of you individually. I think we're all landing around the same place, where we are at a point where we need to stop, pause, figure out how we can support infrastructure and turnkey solution sharing. And that really is, I think, our bread and butter, and typically how we accomplish everything. So what are we doing here today? Why have we asked you to join us? Obviously, this is not something that we can do on our own. At the end of the day, it is going to come back to funding and dollars and cents, and understanding how we can build out an infrastructure so that we can support everybody involved in this process. So right now, and I'll pull on it's the end of Lent, so maybe that's why I said the teach them to fish method here. We don't want to create something where people are relying on us in perpetuity when it comes to issuing a prescription and then facilitating everything that a family needs through it. But what I do think we're in the place to do right now is determine how we can create a new normal in this new, very complex, very busy environment. We do not want to see our clinicians and our clinic staff burn out and leave, which we are seeing in places. We want to be able to support our teams so that they can create easy solutions or easier solutions and then share them with each other. So our plan right now is to put out a request for proposal to our CDCC network, but also beyond our network. We understand that there are probably 20 to 50 other centers out there that are prescribing some of these drugs that are outside of our network. So what we want to do is understand these problems. We want to hear how we can best support solution finding across the board. And then what we would like to do is be responsive and offer one-time support in order to address issues real time. And that's where you as our partners come in. This is, for those of you who are involved in our newborn screening efforts, essentially the exact same strategy that we took way back in 2018, where we said, we know that we have to move on this project. We know that it is a behemoth lift, and we know that we need help. So what we will do, hopefully coming out of this, is put out that RFP, really gather information about what we can address, how we can solution find, how we can share all of this across our network, and then hopefully put dollars behind where the needs are identified and where people need our infrastructure help. And that's where you come in, right? So there is no contribution too little, there is no contribution too large. We will plan to award, again, anything from a pot that we plan to raise. So right now, we sort of call this our raise to fund strategy. It was not part of PPMD's initial plan starting this year, but because the need has arisen and it is now a repetitive issue that we're hearing, as Rachel described earlier, we are hoping to be able to make an impact in the here and now. And then looking obviously towards the end of the year, we don't imagine the workload or the complications to lessen. So what's next? We will package this up so that you can review and share internally as needed. We will follow up with additional information and sort of a more formal outline. But we did want to take the opportunity today to gather everybody, because this is truly an unprecedented moment where we recognize the need for partnership, and we also recognize the need to address what we're seeing as quickly as possible to solution find. So that's our spiel. I have seen some questions come up, Rachel, that I have not been monitoring, but we may want to go back to that. But more to come from us directly. And as always, you know how to find us, and we know how to find you. So thanks again.
Thanks so much, Kaylin. I think, you've raised some really great points, and we really welcome the opportunity to have any, one-off conversations with you and with your teams. I think that you each have had unique experiences as you liaise with your patients as well as with your clinics. And we want to be mindful of each of those unique experiences and how we can work together. So we kept it short and sweet and simple. We hope to hear from you. We will follow up shortly with a recording and with a written proposal, and we're grateful for your partnership. Thanks, everyone.